Hello, everyone. It's Dr. Narapundia. A lot of Golden State Warriors fans are clearly upset about the injury that Gary Payton II suffered on the game against the Memphis Grizzlies on Tuesday. Here's a quick breakdown of what we do for these injuries in general, what the general imaging characteristics are, and what we look for in terms of treatment and return to play. Now, whenever an athlete falls onto an outstretched hand with the degree of force that Gary Payton II did, we always worry about a fracture either occurring at the wrist or across the elbow joint. The reason why we worry about this is when someone lands on an outstretched hand, a lot of times the bones in the forearm can actually impact and jam around the elbow joint and actually cause breaks in that region. In addition, in older patients, sometimes you can see breaks around the wrist. So when an athlete comes out and is having a lot of tenderness around the bone, you want to get an x-ray. Now, other things that can sometimes happen as well, too, you can have just ligament injuries to the elbow, particularly if it hyperextends, or sometimes even the elbow joint can dislocate out. Now, a lot of times when you get an x-ray, the number one thing you're first looking for, if you're looking for any pieces of bone that are completely out of place, this would be a very conclusive x-ray that has displaced fractures that most of the time, particularly in athletes this age, would require surgery. But a lot of times x-rays can be inconclusive, which was the initial report that basically came out during the game. Now, how can an x-ray be inconclusive and not negative? What an inconclusive x-ray means is that you see signs or symptoms that there may be something on that x-ray that basically suggests that a fracture is there. That would typically be swelling in the elbow joint. That we know in adults when they're swelling in the elbow joint, that can mean that there's an occult fracture, which basically means that there's a fracture somewhere around the elbow joint, but you can't see it on an x-ray and you need additional testing done. When you get that additional testing, whether it be a CT scan, additional x-ray views, or an MRI, then you're able to confirm that a fracture has basically occurred in the elbow joint. Now, there are a lot of different elbow joint bones that can basically get broken, but most commonly when you have that kind of fall and you don't necessarily see it on the x-ray, it's a fracture of the radial head, which is basically the top part of the radius bone in the elbow. It's basically on the outside part of the elbow and you can basically feel it on the outside of your elbow when you rotate your arm around. But we don't know necessarily if this is the actual fracture that occurred to Gary Payton, as it's just been reported as a fractured elbow, but this is the most common that you see in this type of injury pattern. Now, when an athlete then gets additional testing, a lot of people say, well, why do you need an MRI for a fracture? Well, particularly with elbow injuries, particularly with this degree of force, in addition to a fracture, there can be degrees of injury to the ligaments around the elbow as well, too, that can both determine the need for surgery as well as determine the return to play timeline. In addition, you can see the cartilage more clearly, as well as get a better three-dimensional look at the bone itself, which can then help to determine what the treatment plan is. Now, when an athlete has this injury in terms of an elbow fracture, the two differentiation factors are whether you need surgery or not. An injury that requires surgery would be season ending for sure. It can be a several-month recovery, and there's always a risk of stiffness, decreased function, and problems in the future. So the most important thing for Gary Payton moving forward is that it seems, based on the reports right now, that he won't require any surgery, which is the best short-term and long-term issue for him, for anyone that has an elbow fracture. Now, in terms of returning to play, there are multiple different criteria that help to determine if an athlete can return to play, or even when a regular individual can go back to work. Now, in general, it takes about 6 weeks for fractures around the elbow that are quote-unquote non-displaced or minor to heal. It takes 6 weeks in general for bone to heal. So for a regular individual who may suffer an injury around the elbow where the fracture is minor or very hairline, it can be 6 to 8 weeks before they get back to activity. Now, what are the criteria that go into determining when an athlete can go back to play? Now, obviously, with the NBA Finals coming up, hopefully for the Golden State Warriors, there can be a push to potentially get him back to play based on the reports. Now, some of the criteria that you need in order to get back to play with this kind of injury is, number one, you need to have full range of motion because elbow fractures are prone to stiffness. Number two, you need to make sure you don't have any pain. Number three, you need to have full strength. And most importantly, number four, you need to be effective on the basketball court. So even though an athlete may have a fracture that may not move, it's very minor, and they have all those criteria. If they can't play effectively, there's no reason to push them back. The other thing that's important as well, too, is that it's based on what the fracture actually is and how much ligament damage there is around the elbow. You basically have to weigh what's the risk of this bone not healing if you go back to play. Well, the bones basically, which are potentially lined up right now, will they move if you go back to play, or will any ligament damage get worse? These are all things you need to consider in basically the criteria of getting an athlete back to play. But if an athlete basically determines, his team and his medical staff determine that the risk of this fracture not healing is very minimal, the risk of the fracture or the bones moving out of place is very minimal, and the athlete gets that stiffness out, they get their pain under control and get their motion back, there is a possibility they could get back to play even before 6 weeks. In general, that's pretty rare, but there's always a possibility because we don't know exactly the fracture pattern that is in his elbow. But there are athletes who have come back around the 4 to 5 week time point with these injuries. But the real question is, how impactful can an athlete be, and what's the risk of them causing permanent damage to their elbow if the injury were to get worse or they were to refracture the elbow while playing? The most important thing is that it sounds like that based on what's reporting, and he doesn't need surgery, this isn't something that will impact Gary Payton II in the future. But once again, it's important to understand that not every fracture is the same. Fractures do take 6 weeks to heal. There are things that you can basically do to help athletes come back a little bit quicker, but there's always a risk of potentially making that fracture worse or hurting the elbow more if an athlete comes back to play sooner. Thank you.